my pleasure to introduce our esteemed speaker, Dr. Hitesh Parmar, Assistant Professor, Department of Business Management, MBA, Sardar Patel University, Vallabh Vidyanagar, Gujarat. Dr. Hitesh brings over 15 years of academic and research experience. He holds a BE in Mechanical Engineering, an MBA in Operations and Marketing, and a PhD in Management. He has also completed a postgraduate diploma in research methodology. He is widely recognized for conducting more than 150 faculty development programs and workshops across India and has trained over 5,000 scholars, teachers, and researchers in data analysis using SPSS, Excel, R, NVivo, AMOS, Jamovi, SmartPLS, and other statistical tools. With more than 30 research publications and 4 authored books, he is known nationally for his lucid teaching style and practical approach in guiding researchers towards statistically sound decision making. Today, he will be speaking on the topic when and how to perform basic statistical tests, an introductory session with online demo. I welcome you, sir.
Thank you, Dr. Isha Malik, for a wonderful introduction. Thank you, ma'am. Thank you all participants. And we begin our session. I'm just sharing my screen. I hope I am audible to everyone.
Yes, sir.
Thank you. So briefly, today in 1 hour, we will be discussing about the statistics, how to identify appropriate statistics. That is the agenda for the today's session. Meanwhile, if you have in between also any questions, you can put your questions in the chat box. And then last 10 to 15 minutes, we'll see your question and we'll discuss. Because of the time limitations, we'll not take in between the question. But because the session is about 40 to 45 minutes, so we'll try to finish my content within the prescribed time, and then we'll switch to the question answer session. But feel free to ask questions at any point in time. Just put your questions into the chat box and we'll take your questions at the end of the session. So every time, whenever we are doing some kind of research, we are having a dilemma that how to identify that which statistics is appropriate for our kind of a study. Right, no matter whether you are from maybe Ayurvedic or maybe science background or any other discipline, or like me, a management discipline, every researcher is facing the same dilemma that how do we know that which statistical test should we perform or which statistical tool we should be identifying for analyzing the data. So let us start our discussion about this. But before we go into this, for any kind of research, why statistical analysis matters, right? Though statistical is only one part of your research, right? It is not the entire research, but we consider the only the part of the research, but it is the important, or we can say more or most important part in your research. So that determines the make or break of your research, because statistics can enhance the quality of your research, right? So why statistical analysis matters? Because it provides you the scientific credibility, right? We are not just talking about the facts and our own experience and everything. If the appropriate statistical tools we have performed and analyzed in our data analysis, then it provides us the scientific credibility. And credibility is the desirable characteristics in every research, right? So we need scientific credibility. At the same time, we are making the decisions, and what we can say, we are taking the informed decisions, right? So we are not just guessing or predicting the outcome or analyze without analyzing, just we are providing our decisions based on our intuition or feeling. But statistical, if the decision making is based or it is backed by the statistical analysis, then it can you can take the informed decisions. It identifies obviously relationships, patterns, and trend, right? So it is one of the objective behind the statistical analysis, that to see how our variables are related with each other, whether some patterns or trends are emerging or not, right? So we are also interested in identifying the patterns of relationship, in identifying the trends in the data. So it helps in identifying relationships or patterns or trends. At the same time, we are not limiting ourselves to our samples, because we want to go beyond our sample, right? Though because of the time limitation, because of the cost limitations, we are collecting the samples. But actually these samples are what? They are the representations of the larger populations. So after applying the hypothesis testing, we are just generalizing our finding to the larger population. So hypothesis testing, one of the what we can say, the purpose of the hypothesis testing is to generalize the findings to the larger population. And at the same time, reliability analysis, validity analysis, that gives us the validating the research instrument. While designing our study, we must have designed our research instrument, maybe the some tools we have developed, or some tools we have borrowed from the previous research. So that research tool, research instrument needs to be validated. So how do we validate? So through reliability analysis, through different types of validity, we are validating the research instrument. So statistics will help in validating the research instrument also. And it also supports hypothesis testing, and at the same time makes research replicable, because replicability is the desirable characteristics behind any research. So whenever we are conducting research, right, we want that our research must be replicable, right? Same study can be replicable in the different regions, different populations. So we desire the replicability in our research. So this is what the importance of the statistics, that we are, why statistics matters most in the research. Now when we are taking the decisions regarding the identifying the statistics, that will purely depend upon the what kind of data you are dealing with, and the scales of the data, or the scales of the data, we are categorizing into four. I hope you are aware, but still we are just briefly touching it. There are four scales of measurement. You can just write in the chat box if you are aware or not aware. So I just know the background of your maybe, because this is a mixed group. So some of you may be aware or not aware. I don't know exactly, but you can put your comments whether you are aware or not. So identifying the statistical test or statistical technique purely depends upon the scales of measurement. Which scales of measurement you are dealing, that will determine that again what type of statistical test or statistical analysis you can perform on the data. So the most basics scale of your data will be the nominal. Nominal means it is the categorizing, right? Categorizing the data. So maybe we are categorizing our data into two category, three category. So the numbers, suppose you are making the numbers here, the three types of dosha, vata, pitta and kapha dosha that you are uh, making, right? So maybe we are giving a number vat as a 1 or pit as a 2 or kapha as a 3 in terms of while we analyze the data. But numbers don't have any meaning. The numbers don't have any meaning. You can give any number to the categories because it is just the nominal scale. So nominal scale, what do we understand? Numbers don't have any meaning. We can put 99 and 100 also. Suppose gender, we are collecting the data regarding gender, male and female, so we can provide 1 and 2 also, or we can provide 99 and 100 also. So numbers doesn't have any meaning. It can be any number, right? You can see the players are given the some certain numbers on their t-shirts. So why do we provide certain numbers on their t-shirt? Because just for identification, right? If you see that number, then you can associate that okay, fine, this is the number, so this person is this. So behind the reason is what? Just for identification. It is our reason. So here, suppose dosa type we are giving Vata, Pitta and Kapha, or Prakriti you are categorizing as a Vat, Pitta or Pitta, Kapha, right? So these are the uh, uh, just the numbers represent the identification. The blood group also you are identifying. So whatever the categorical data are your nominal scales of observations. Then second one is your ordinal. Ordinal, the name itself, it is suggesting that we are having certain order, right? There is some hierarchy, there is some order in your data. So now you can say that this number is higher and this number is lower. Earlier we were not able to say, but now we can say that there is a hierarchy, there is a ranking in the data. So there will be some meaningful interpretations that you can perform in terms of ordinal scale. In terms of nominal data, you cannot interpret the numbers, right? We cannot say, for example, a mean. If you want to calculate, we cannot calculate mean of the gender, right? It is 1 and 2, so we can't say that it is gender of the respondent is 1.2. We can't say, right? So the uh, it cannot, numbers cannot be interpreted, or 2 is higher than 1 in terms of nominal, we cannot say. All categories are same. But in case of ordinal data, yes, we can say that this number is higher and this number is lower. So for example, that you are categorizing the severity level of the anxiety, right? So there is a scale of the anxiety, and based on that scale, you are categorizing the anxiety based on mild, moderate, or severe. So severe is higher, moderate is medium, and mild is the lower case. Right. So now you can categorize. Suppose 1, 2, and 3 number you are providing to the based on the severity. Then 3 is higher than 2, 2 is higher than 1. Right. We can say like this. So the ordinal scale always you can interpret based on their order, based on their hierarchy. Numbers do have some meaning, some interpretations, like the physician or Vaidya assessing quality, like the dryness of the skin as mild or moderate or intense, right? So intense is the higher, moderate is the medium, and mild is the lower. So again, 1, 2, and 3. So here what the numbers can have interpretations, but the limitations is also present. What is the limitation? Can anybody comment about the ordinal scale if you are aware regarding the limitations of the ordinal scale? So ordinal scale, the limitation is what? That the difference between two consecutive number is not always same, right? We are having this number 1, number 2, and number 3. But the difference between 1 and 2, 2 and 3 is not always same. We can't say that difference between mild and moderate and severe is the same. right? So here it is the subjective nature. So the difference, the consecutive number, the difference is not same. Yes, we can say severe is higher than the moderate, but the relative difference between these two is not same. So this is the limitation of the ordinal data. Then the third one is the interval. Interval data, it means that we are having some order, there is some hierarchy in the data. So earlier we don't have that equal distances among the categories, but now in case of interval data we are having equal distance properties. So say for example body temperature we are measuring in terms of Celsius. So for example 21 degrees Celsius, 22 degrees Celsius, and 23 degrees Celsius. These are the three body temperature that we are measuring. So now we can, if we identify any two consecutive number and then if we find the difference, every time we'll get the same answer. Say for example, 19 degree and 20 degrees Celsius and 35 degrees Celsius and 36 degrees Celsius. So the difference is same, right? So 1 degree Celsius we are getting. So here what we need to understand is the difference between two consecutive point is always same. So which is true in case of the interval scale. So if your data is interval, it means they are having equal distance property. Here also there is one limitation. What is the limitation? So limitation is what? That the can we say that 0 degrees Celsius temperature is the lowest possible temperature? No, we can't say. The temperature can go in negative also, right? Suppose the room temperature we are measuring, so temperature can go in negative also. So what does it mean? That 0 doesn't mean that absence of phenomena. In terms of interval scale data, if you are coming as a 0, then 0 doesn't mean that the absence of phenomena. Below 0 also there is a possibility that your data can go below 0 also. So 0 is just a matter or the reference point among the all the scale available. Below 0 also there are certain data points which you can the data can go below 0 also. So this is the case of the interval data. And the last scale of measurement, it is your ratio data. So ratio data, 0 means 0. Below 0 not possible, right? Say for example the blood sugar or blood glucose, cholesterol. So whatever the properties, the blood properties that you are measuring as a part of your job, so this all will fall into the ratio data. Weight of a person is a ratio data, height of a person is a ratio data. So you can add, you can subtract, you can multiply, you can divide the ratio data. And 0 means 0. Below 0 it is not possible, right? Here in terms of dosage, the amount of suppose Ayurvedic churna that you are giving to a patient, it measures in terms of grams. So 0 gram means 0 gram, right? It can, you can't the data can't go below 0. So it is your ratio scale data. So we understood four scales of measurement: nominal, ordinal, interval, and ratio. Now whenever you are collecting any type of data, your first your first question should be that what scales of data I am dealing with. This should be your first question, right? Am I dealing with nominal data? Am I dealing with ordinal data? Am I dealing with interval data? Am I dealing with ratio data? So any type of data that you collect, you should be able to identify that which scales of measurement you are dealing with. This is the first step in identifying the statistical analysis. Once you are very clear about the scales of measurement, then we can bifurcate our analysis. Maybe in different ways we can understand. One of the way is to bifurcate the entire analysis in terms of the number of variables that we are dealing with. How many variables we are dealing. So if we are dealing with only one variable, so it is univariate. If we are dealing with two variables, it is bivariate. If we are dealing with more than two variables, it is multivariate. So univariate, bivariate, and multivariate, this is the terminology used in the statistics, right? Univariate, only one variable; bivariate, two; multivariate, more than two. Now, say for example, you have only one variable. So this will be the univariate. Now, within the univariate, the data can be nominal, the data can be ordinal, interval, and ratio. Suppose only one variable you are having, that a gender of a person. So it is your which scale of measurement. You can just type gender of the respondent or gender of a patient, for example, the male or female. So it is which type of scale. Just type your answer. Participant, just use your chat box. Are you allowed to type?
Participants are requested to type the answer in the chat box.
Yeah. So the question is a gender of a patient, for example. So it is which scale of measurement? Is it ratio data? Is it nominal? Is it ordinal? Nominal. Yes, yes. Now I am getting the answers. Good, good, good. Okay. So it is the nominal data, right? So for nominal data, what should be the analysis that we need to perform? So nominal data is what? Numbers don't have any meaning interpretations, right? So what you need to do, just you need to generate the frequency table and chart. Frequency will be frequency and percentage. That, say for example, you have 300 patients, so out of 300, how many of them are male, how many of them are female, and based on that frequency, the percentages will be calculated by the software, right? So frequency, percentage, number one. Number two, pie chart. This will be your single nominal data, nominal variable. So you can perform this analysis, nothing more than that, right? Say for example, you are having ordinal data. Then what you will do? The same, say for example, you have this uh, anxiety where mild, moderate, or severe. This is the uh, anxiety you are classifying, right? So again, what you can do, you can generate the frequency that out of, say for example, 100 patients, how many of them are under the mild, how many of them are under the moderate, and how many of them are under the severe, right? So this is the one of them. Here you can have bar chart also, you can have pie chart also. Previously also you can present a bar chart, but suppose with respect to percentage, if you want to see your categories, then pie chart is more preferred. And if you are having the categories and you want to see the comparison level, then maybe the bar chart is more preferred, right? So here also per frequency, percentage, and median you can calculate here in terms of ordinal scale. Now there are three measures of central tendency. I am not going into the detail, but there are three statistics, descriptive statistics: mean, median, and mode. All three are averages, but generally mean is more popular, so it is more associated with the average word. But actually mean is also average, median is also average, mode is also average, right? So out of these three, we can calculate median here in terms of ordinal data. That median is what? That divides the entire sets of data into two equal parts. This is the median. Mean is summation of all values divided by number of observation, and mode is what? Highest occurring frequency is the mode. So out of these three here, in terms of ordinal data, suppose measures of central tendency, if you want to add, then you can add median. And in terms of the interval as well as ratio data, you can perform everything, but the preferred one is the mean, standard deviation, minimum, and maximum. These are the four things you should calculate if you have any interval data or if you have any ratio data. What four measures? What is the minimum value? What is the maximum value? What is the average mean value? And what is the standard deviation? Right? These four things you need to prepare: mean, standard deviation, minimum, and maximum. Suppose you want to add a chart, then histogram can be preferred. Right? In terms of chart, for interval data or for ratio data, you can put histogram. So this will be the univariate analysis with respect to nominal, ordinal, interval, and ratio. Now suppose you have two variables. Now if you have two variables, then you need to answer the question that what is your objective? Are you looking for a differences or are you looking for association? Right? If you have two variables, you need to ask a single question that what is your objective? Your objective can be number one, to look for the differences, or number two, your objective could be number two, to look for the associations. Now what is the difference? Difference is meant you are comparing the groups. Right? Suppose you are comparing the responses of male versus female, or suppose you are comparing the two groups of one is having a placebo and one is having some treatment. So treatment group and placebo, right? So maybe you are comparing two types of group. So this is your comparison, that you want to compare the difference in the two groups, or maybe three group, four group, depending upon the number of groups. So if your objective here is to compare the number of groups, then it is your difference that you are looking for, group difference. Or you are looking for the associations. Associations means how the categories of these two variables are associated with each other. So this is the association. So if your objective, let us stick to this one, that if your objective is to look for the differences. Now, if we are looking for the, say for example, if we consider the both variables are nominal to nominal, then here you can perform, this is the non-parametric association test. Either you can go with the chi-square test or you can go with the Fisher's exact test. In which circumstances you will go, both variables are nominal to nominal and your objective is to study the association. So say for example that both variables are nominal. So how we can say that is Prakriti, where the types of Prakriti, there are three types associated with frequency of acidity complaint. So can we associate any one type of Prakriti is more having complaints of the acidity and rest of the other two are less? Or is there any association between type of Prakriti and the acidity complaint or not? So you can collect maybe 100, 200 responses and then you can check that type of Prakriti is your first variable, nominal, and frequency of the acidity complaints. Right? Frequency, you can count the frequencies in a month or maybe in a week time, or like this you can count the frequencies and then you can associate it. Right? So the purpose of the chi-square is what? To study the association between two categorical variables. So this is your chi-square. It is your nominal to nominal, or any, suppose in ordinal also, interval also. That data, if you are able to convert into the frequencies, then yes, you can go with the chi-square test. So chi-square test of association, you can go for association between two categorical variable. Now what the Fisher's exact test is what? Say for example, you have small samples and 2 by 2 table only, 2 row and 2 column. Here we are having, say for example, Vat, Pith and Kapha, so there are 3 rows, right? But suppose you have only 2 row and 2 column, like say for example, is the presence of amma yes and no related to joint pain in a sample size of 25? So a smaller sample and only yes no yes no. Row is also yes no in terms of measured yes no. Column is also measured in terms of yes and no. So yes and no, yes and no, there are 2 by 2 matrix. So instead of chi-square test where your sample size is also small and only 2 by 2 matrix, so you can go with the Fisher's exact test. So this is the most popular chi-square test and Fisher's exact test are most popular non-parametric test available for the statistical analysis. Say for example, if you have ordinal data. Now, ordinal data, we need to answer the question like that. First of all, how many groups we are dealing? Are you dealing with 2 group or are you dealing with more than 2 group? Because 2 group also the test is different, more than 2 group also the test is different. So if you are comparing the 2 groups, then your uh, non-parametric test will be Mann-Whitney U test. Say for example, difference in pain reduction scores between Ashwagandha and Shalakay group. So these are the 2 groups, right? So these 2 groups you are comparing and average pain reduction score, that whether the group A is having reduction in the scores or group B is having the reduction in the score. So median difference you are comparing here with respect to Mann-Whitney U. Now same data, suppose if we are changing to the interval or ratio data, then the test will become independent sample t-test. So if I go back here, say for example that looking for a difference, you are comparing the 2 group, then if it is a interval or ratio data, then it will be a case of independent sample t-test. And if you are comparing the difference with respect to ordinal data, then you can go with the Mann-Whitney U test, right? So same, say for example, here also independent sample t-test also, we are comparing the 2 groups. Say for example, mean reduction in the anxiety score with respect to the same ashwagandha group compared to the placebo group. So say for example, one group you are providing the tablets of the ashwagandha, second group you are providing the same look like a tablet but not the ashwagandha. And for this 2 group you are just see the average reduction in the anxiety score. So group 1 and group 2 you are comparing, right? So here the variable that we are interested is what? It is the anxiety score, which is the interval data. So that is why we are going for the independent sample t-test. For parametric test, if there is a uh, assumption regarding the parametric test that the data must be normally distributed. So we need to test the normality first. For the anxiety score, we need to check the normality. If it is normal, then only we need to move ahead. So you may have questioned that suppose the data are not normal. So what should we do? Then you need to switch to non-parametric test, Mann-Whitney U test. Right. So 2 group comparison problem is either it will be independent sample t-test or it will be Mann-Whitney U-test. This is the 2 group problem. Now, do you want me to continue this discussion, or maybe 5-7 minutes we can open any one software and we can see how this test can also be performed? What do you think? Do you want me to provide some demonstration also, or do you want me to continue or finish the more than two group and other types of the statistical analysis also? Because we have roughly 8 to 10 minutes left for the session, and then question answer definitely. So depending upon your choice, we can plan. Demonstration of the test. Okay. Okay. So now if you choose, you may have a question that what type of software you can use, right? So statistical analysis, the most popular software is SPSS. Which is the most popular software? SPSS. SPSS is what? Statistical Package for Social Science. This is the SPSS. The full form of this software is what? Statistical Package of the Social Science. Now, but this software is not a free software. Free software you will have also choices like a Jamovi is a free software. You can use Jamovi as a free software. R is also very popular, free, but it takes some time to learn the R because some coding is required. But Jamovi without coding, you can understand. Excel is also very powerful. So you have multiple choices available with respect to your data analysis. SPSS is also available, very popular. Excel is also, you can go easily available, Excel, and very powerful. You can do all types of analysis in Excel. Then you have Jamovi, you have R, and depending upon your other types of requirement also, there can be multiple softwares available. Right, say for example, this is a software called SPSS. Like, for example, if I just open the any blank file, let me open the blank file only so that you are aware. So this is having a two view, data view and variable view. Right, variable view we are just writing the name. For example, you are having a gender of a patient. So gender, just I am typing gender, and then you need to provide the values. These things, let us skip the type, it is numeric. Just we are coding it, right? So value is 1 and male because we are providing the numbers that 1 is male and 2 is female, like this. And okay, and this is measure is the nominal, right? And now suppose randomly if I put some observations like 1 2 1 2, so suppose 10 observations. Now for this, how to do the analysis? So we can just click on analyze, then a descriptive statistics, and for nominal data we understood that we can go for a frequencies. So just click on the frequencies, just select this particular one, and it is written display frequency tables. Along with this frequency table, suppose you want a pie chart or bar chart, suppose a pie chart, then pie chart, and just continue and okay, and then you will have your result in the new sheet. Like, let me share that one. This is the result that we are getting, like gender, frequency, percent. Valid percent is there is a column because suppose some missing values are there, then you can manage with the valid percent, and cumulative percent also. So this is a table is available, right? So suppose if I just click on this descriptive statistics, and here descriptive, suppose if I go and see the options, so all types of statistical analysis you can do within a click: mean, standard deviation, minimum, maximum, all this skewness, kurtosis, it is the shape of the distribution that we are interested, right? So if we can perform here the descriptive statistics like this, because the variable is not suitable, we can also say the compare mean option. So you can have the parametric test like independent sample t-test, paired sample t-test, one sample t-test. These are the three types of t-test we can perform from here. And also we can perform the one-way ANOVA. Then for non-parametric test also we can have this one, like two independent sample is our Mann-Whitney U test, K independent sample is our Kruskal-Wallis test, two related sample is our Wilcoxon sign test, right? So chi-square test of independence is also available. Here, the chi-square test of association is also available in the cross tabulation, right? So parametric test, non-parametric test, you can have correlations also, where you can perform the Carl Pearson correlation, Kendall, Stauss, Spearman also. Regression also you can perform, right? Regression also, linear regression also, logistic regression also. So there are modules available. In terms of here, multivariate data analysis technique, if you want to go, cluster analysis, hierarchical cluster is also available. K-mean cluster is also available. There is a technique called discriminant analysis in the multivariate, so it is also available. Dimension reduction factor analysis, which is also more popular. Reliability in terms of your instrument, research instrument, you need to validate and reliability testing. So here also reliability is available. In terms of your medicine, the popular technique is survival analysis. So here also there is a module of survival analysis, right? So perfectly suitable for all types of analysis. They are need. If you have survey data, if you have forecasting time series data, this software is perfect for you, right? So this is the software called SPSS. There is a software called Jamovi, which is also a free software. Right? You can just search the internet and just Jamovi, and then it is a free software. Right. So with respect to this also, Jamovi also, it is also a very powerful software. For example, if I am having any ready-made file available, I can let me open any one file. Right. So here also you are having these options of t-test, independent paired sample, one sample, ANOVA also, ANCOVA, MANOVA also, one way, repeated measure, regression also, factor also. Right. So this is also very powerful software in terms of this one. And the best way is that here you just select the variable, and then on the right side you will get your analysis. Right? Don't have the exact to group in this data file, so that is the reason. Right? So here just you select this one and then you will get the outcome here. Right? So this is also very powerful and free software, Jamovi. Right? Now depending upon the because it is 7:53, so I am just stopping and I welcome your questions.
Thank you, sir, for an enlightening and highly practical session. We now open the floor for questions. Participants are requested to post their questions in the chat box.
Any question, participant?
Participants are requested to post the questions in the chat box. Do we have any queries?
Any question? No question? There is a question.
Sir,
Can
can
multiple scale be applied on some parameters? Uh, can you elaborate that what kind of parameter you want to address? What exactly you want to measure? Uh, can you elaborate your question? A multivariate data analysis, so definitely yes, you can have the combination. So either some variables will be interval, some ratio within the interval data also. Some it is possible that one construct is having 5-point scale, another construct is having 7-point scale, right? So within the construct also there can be a variation in the scale also, and for a single kind of the parameter also, yes, because say for example the factor is too large and you may require 15 to 20 variables, so depending upon that the scale may have some difference, some are interval, some are ordinal. Yes, it is possible. And there is a question where we can use live tables. Live tables means the frequencies of the of your analysis, the table that you are generating, right? All this you can use in your writing a research paper or maybe in your dissertation thesis, right? Depending upon your objective, you can have the usage of your live tables. Here you can see this because many participants are not aware regarding this tool pack which is freely available in Excel. If you just click on the data tab, then here it is written data analysis, right? So this tool is freely available, data analysis tool pack. If you click there, then you will be able to see this all ANOVA core is alphabetically it is arranged, correlation, descriptive statistics, right? So in Excel also you can perform majority of the analysis. Still regression you can perform. Any other question, participant?
Thank you for the active questions and discussion. Thank you so much, sir.
Thank you, Dr.